Hello, I'm John Sutton, DO, endocrinologist, Carson City, Nevada. Today I'm going to speak on blood sugar testing in diabetes diagnosis and follow-up. First of all, the diagnosis of diabetes mellitus is made by serum glucose testing. Fasting serum glucose of less than 100 is a normal value. Fasting serum glucose of 100 to 125 is in the range of pre-diabetes, and fasting serum glucose of greater than 125 is diabetes. If there's any doubt, such as a lack of symptoms, if the patient is not having excessive thirst or excessive urination, for example, you need 2 abnormal serum glucose values. The diagnosis should not be made by fingerstick blood glucose monitor check. Hemoglobin A1C, diabetes diagnosis. If diabetes is diagnosed, if the A1C is equal to 6.5% or higher, you may need 2 of these if there's any doubt in the presentation of the patient, such as a lack of symptoms. Red blood cells contain hemoglobin, and that is glycated on a day-to-day basis. That glycation is measured as A1C, and the lifespan of the red blood cell is approximately 2 months, and therefore the A1C measures percentage of glucose attached to the red blood cell hemoglobin over a 2 to 3 month blood sugar control. We are seeking an A1C as close to 7% as possible. You should know your A1C, and your doctor should be checking that at 3-month intervals. Fingerstick A1C is okay to use in follow-up, but should not be used as a diagnostic test for the diagnosis of diabetes. With home glucose monitoring, you should use a brand name meter with brand name strips. Do not use generic strips. The strips should match the meter that you're using. You should check your blood sugar before meals and at bedtime, before breakfast, before lunch, before dinner, before bed. That should be 1 to several times a day. So it doesn't have to be 4 times a day, but at different times or 4 different times a day to present to your doctor. You should document these on paper or download the meter readings for presentation to your doctor, as the doctor should be making a decision about adjustment of your treatment plan based on home blood sugar monitoring. This is done rather than using A1C as a way to make an adjustment. Now, your doctor may see the A1C rising and may want to adjust your plan, but that plan should be adjusted on home blood sugars. You should seek home blood sugar values that are as close to normal as possible. Those normal values in serum glucose would be fasting blood sugar less than 100 is normal, and 2-hour postprandial or post-meal blood sugars of less than 140. Aggressive diabetes control should be pursued unless there's significant hypoglycemia in reaching the goal. Check middle of the night blood sugars to present overnight hypoglycemia. The goals of home glucose values help to prevent diabetes complications, vision disturbance and blindness, foot alteration and amputation, proteinuria and chronic kidney disease with kidney failure and dialysis, heart disease with myocardial infarction are things that we're seeking to avoid by tight blood sugar control. Another way to evaluate home blood glucose values is a continuous glucose monitor. Continuous glucose monitor measures interstitial blood glucose, and the interstitial blood is not exactly the same as the serum glucose or the fingerstick blood sugar, but it is in a relatively same range. It is typically similar to the capillary blood sugar obtained by fingerstick. Subcutaneous device is placed by the doctor and or the patient and is replaced every 10 days to 2 weeks. You should download, print out, or and document those glucose readings for your doctor to review. In regards to the pump and home glucose monitoring, insulin pumps are subcutaneous devices used to supply continuous insulin and bolus insulin for a high blood sugar and carbohydrate food insulin dosing. You should report your blood sugars to the doctor for treatment adjustments. Some pump settings allow for the pump to automatically adjust the basal rate for that individual patient in continuous glucose monitoring. Again, this is blood sugar testing in diabetes, diagnosis and follow-up. Glucose testing to make the diabetes diagnosis to include serum glucose, capillary and interstitial glucose values. This is John Sutton, DO.